Years I have played some characters you could call controlling, but the truth is there's so much in life we can't control. But here's something we can: colorectal cancer. It affects men and women, and it's the second leading cancer killer in the U.S., which is astounding.
Connecticut resident there, Meryl Streep, just the latest celeb to put her face on the importance of colorectal cancer screening. March is Colorectal Cancer Awareness Month, so we brought in Dr. John Birk, Chief of the Division of Gastroenterology at the UConn Health Center, to talk more about the importance of screening and even better prevention. Good morning to you, and thanks for coming in.
Yeah, well, thanks for inviting me.
Meryl Streep, Katie Couric, of course, being one of the first celebs. You know, we're starting to see big names, big faces put on this. Is that helping deal with the stigma so many people have about it's too embarrassing, I can't possibly go get, you know, an exam?
Yeah, no, I think it's very helpful. I think that, you know, the point of March and Colorectal Cancer Screening Month is to, you know, get the word out, and I think the celebs help that, and then anything that helps people, as we were talking before, reduce the stigma of it, and just get people aware of the fact that there is a point or time when they need to get screened, which, you know, as we know, starts at age 50.
Right, or if there's a family history, sometimes even sooner, right?
Right, family history sometimes dictates earlier screening. Yes.
So screening has come a long way as well, and there's something going on at UConn, one of the first medical centers, to have a particular device that helps when it comes to finding polyps and screening? Yeah,
there's, I mean, I won't say that colonoscopy is still the best method around, and it's improved. I mean, the insertion tubes have improved. We now use propofol sedation, so it's less
more comfortable.
More comfortable.
And what about an endoscope? How does that?
Yeah, and the new endoscopes also are now high, just like television.
Oh, yeah, we love that. It's good for you, not good for us.
Yeah, it's good for everyone. the new endoscopes are now high definition, and the high definition, you know, obviously allows for a better look at the colon, the walls, and, you know, detect polyps more readily, detect smaller polyps, and really give you a more thorough exam. And so, yes, we got one of the latest generation of the new endoscopes, which, you know, hopefully will help even more with our tool of colonoscopy for prevention.
Yeah, and speaking of prevention, it's encouraging to hear that there are some things you can do to try to get those risk factors down a little bit, and a lot of them have to do with making changes in your diet and exercise. Can you go through some of the things that you can do that might help with that?
Yeah, well, here in Connecticut, one of the things that I think we've come up with or I've talked about a lot is calcium. You know, we don't get a lot of vitamin D, and then also our calcium levels go on. So it's a good thing to check with your primary care physician to make sure that your vitamin D levels are okay and that you're getting adequate calcium in your diet. That also helps for colon cancer.
Interesting. I didn't realize vitamin D played a big role in preventing.
It plays a reasonable role. It's one of our, you know, modifiable risk factors, as we call them. So it's useful to keep an eye on that, especially since here we don't get a lot of sort of sunshine in the wintertime, and it becomes more of an issue.
Especially this winter, too.
Yes.
Could you run through a couple of things so people might be watching thinking, I wonder if I have reason to believe I might have some of the symptoms of colorectal cancer. What are some things that they should look out for? When should you call the doctor?
Well, certainly when you see blood in the stool, you know, is number one. If you have sort of an unexplained weight loss, that's another thing. If your stool has sort of changed in caliber and it's worrisome, or if you know, clearly if you have abdominal pain that you really can't explain for, you know, last night's indiscretion, those kind of things are the early warning signs, or no, I won't say early, but the warning signs for colon cancer.
Well, March is the month to talk about this, so thank you so much for coming in. Hopefully we got some attention, because again, the earlier you find it and screen for it, the better.
Yeah, early detection defines cure.
That's the one. Good words to live by. Dr. Birk, thanks so much for coming in.
Thanks for having me.